Hi, this is Dr. Duresti with the cranial release technique. I wanted to follow up from last week's video on the Dura Mater and does the Dura Mater really matter? And obviously, in my opinion, yes, it really does. Before we get started, if you wouldn't mind to like, share, and subscribe to the YouTube channel. This way we can help more people to understand the benefits of the cranial release technique so we can help more people around the planet. Okay, I'll link below the video from last week where we discussed the Dura Mater. And if you recall, here's the plastic model of the skull. On the inside walls of the cranium is the Dura Mater, the outermost covering of the brain, harder than bone. Two Latin words that mean tough mother, Dura Mater. The Dura Mater is part of the periosteum of all 22, again, of the inside of the cranium, attaches here at the foramen magnum, the big hole in the bottom of everybody's head, attaches at the first cervical, second cervical, third cervical bone, and then sort of free floats down, covering the spinal cord, reattaching at the second sacral tubercle, and also blending with the periosteum of the coccyx. So we have this very firm craniosacral connection. And as the cranium shifts, that then stresses the dura. As the dura stresses, that then changes the alignment of the spine and the pelvis, and the patient now goes through life in a suboptimal state of being. Again, using the Hoberman sphere. Remember, the purpose of cranial release is to unlock and allow this normal cranial rhythmic mechanism to take place. It's happening in all of us. All 22 bones are taking place in this movement. If we talk about the dura, again, the dura is the inside, on the inside wall of the cranium. And so if the dura gets stressed because the cranium now has shifted, so you'll notice with some patients, one eye smaller than the other, one eye lower than the other, ears rotated forward or backwards. The maxillary arches, these arches right here, one will appear lower, one will appear lower. All of those distortions affect the movement of the cranium, so that will be reduced and restricted. That will negatively impact the central nervous system, the brain, the spinal cord, which controls everything in your body. In addition to that distortion, the eye small, the eye low, the ears rotated, all the osseous, bony distortion that you see, that will then negatively impact the dura, and that will stress the dura all the way down to the pelvis. So now you have the cranium that's distorted, the dura is under more tension, the spine is distorted, the pelvis will be distorted, one hip will be higher than the other. A nice little example you can do just to prove to yourself what I'm talking about is if you can get two bathroom scales and put them together and put 1 foot on one scale, 1 foot on the other scale, and look at the readings, and the number should be within 0 to 5 pounds difference. And what you'll see with some people, what I used to see with some people, one leg would be carrying maybe 10, 15, 20, 30 pounds more than the other. That's just a sign of misalignment throughout the whole structure. And of course, as the structure goes, so goes the function. So then that person that's carrying all that extra weight then says, well, gee, my ankle's bothering me, my knee's bothering me, my hips bothering me, my back's bothering me, all these different things. And without me going to the ankle, the knee, the hip, the back, by correcting the cranium with the cranial release technique and unwinding all of this and letting the body unwind itself, so to speak, and then you could do any other technique on top of that if you like, whether it's massage, chiropractic, acupuncture, physical therapy, whatever the title is after your last name. that will just help the patient in such a great detail, because if you only work on the ankle, only work on the knee, only work on the hip, only work on the back or the spine or wherever, you're missing the main player in the game, which to me, again, is the cranium. You really need to look into cranial release technique. Whether you're a patient, you can visit our website at cranialrelease.com and search for a practitioner. Or if you are a practitioner, if you're out there and you're a chiropractor, an osteopath, a dentist, a nutritionist that's looking to optimize function, if your license allows you to touch a patient, a physical therapist, a massage therapist, whatever it is that you do, if you would include the 1-minute cranial release technique first, and then go back and recheck, and then do your needles for the acupuncture, your chiropractic, your massage therapy, whatever it is that you currently do, your patients will get better sooner, your results will go through the roof, the word will go out in your community that you're the person that helped me get well, and people will beat a path to your door to get this thing called cranial release technique. I've been teaching this for a long time now, and I've seen every type of practitioner from every kind of background say, I had a good practice, I'm doing well, thank you. When I added cranial release, it took me to a whole new level of practice, a whole new level of being able to help people, and it's all based on anatomy and physiology. This is Dr. Duresti, cranial release technique. Again, if you're a practitioner, go to the website, cranialrelease.com, click on the online training button. That will take you to the website where you can learn more about how can you learn the cranial release technique, this very simple but very, very precise 1-minute technique in the comfort of your home or office, cranialrelease.com. This is Dr. Duresti signing off. Happy weekend to all of you. Hope to see you soon. See you on the next video. Thank you so much. Have a great day. Goodbye.